Well, I will call the prison board meeting to order. Everyone please standing for pledge allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. This meeting is being recorded. As said in the meeting will become part of the record. Is there any cause to go to executive session? No. Okay. Very good. We have one presentation on the agenda today, and that would be Lonnie Heeter regarding medical report. We found out, I think it was about a year ago, that we're supposed to get a medical report once a year. I think that's part of the law. Title 37. Title 37, and we just found that, so take it away, Lonnie.
All right, so some of this will be repeat, but basically the contract right now is set up where I'm there 6 days a month for acutes and new intakes and such. Dr. Horner's there 2 days a month to do that, and then of course we have a nurse there full-time 40 hours a week, and then another nurse 16 hours a week, and plus then of course I'm on call 24/7. So I'm going to get on through some of the numbers. This is the first 11 months of this fiscal year. We've had 379 new intakes. We have had 370 plus acute visits. We've done 872 COVID tests, 531 nursing visits, 300 plus tuberculosis tests. The last time we did this, they asked for kind of a breakdown of what kind of things we want to see, which of course can change depending on what the clientele is. But the most chronic things would be diabetes, type 1, type 2, hypertension, chronic obstructive pulmonary disease, migraines, diverticulitis. We seem to see a lot of med checks, follow primary care stuff. Acutely, COVID, unfortunately, was fairly high on the list. Cough, sinusitis, otitis, urinary tract stuff, allergies. It's amazing to me, the small population, the amount of these guys are not, and gals are not, in the healthcare system that much when they're not in the jail, and so when they come in, there's a lot going on with them. Gynecologically, of course, we've had a few pregnant women, STDs, yeast infections, bacterial vaginosis. Psych, we do have psych that comes in, mental health, and I don't know what their schedule is exactly, but I still get involved in some of that, not the complicated psych issues, but a lot of people come in depressed or anxiety, whatever, and I may initiate some therapy with them, but then refer them to the psychiatrist, because unfortunately it takes some time to get in to see them. Orthopedics, of course, lots of bone and joint problems, back pain, things of that nature. A lot of derm, mole checks, dermatitis, psoriasis, abscess. We've had our fair share of MRSA in the jail, which is every jail, every place in the world now. Cellulitis. So those are the common acute things that we see. Questions? Anything else that I should be covering?
TB tests seem high to me.
Well, that's a standard of care. When they come in, we have to test them. Okay. And so any of those new intakes, now, sometimes they're not there long enough to get their TB test. They may be in and out, but we, that's standard. They all have to be tested because in the jail is the highest risk area, outside of third world country. For tuberculosis, and we haven't had any active TB that we know of, but we've certainly had some positive TB tests over the years, although it's been a while. Yeah, exactly. And of course, the COVID numbers, a lot of that is driven by transfers, and people have to know that they don't have COVID, and so we have to test them before they can leave the facility. So, and plus, when we have one person get COVID, then all of a sudden you have to test another 100 people.
Yeah.
Because you have to try to isolate it. And we've been fairly successful, you know, actually at ridding the jail of it when we've had it there. So, whether there have been 2 or 3 outbreaks.
3.
3, yeah, so. So that's been, actually went better than I've expected, you know, honestly, because it is quite contagious, of course. But, yeah.
You had a number related to intake that was, what was it, 300
79.
379? I guess this is just a general question because I've never dug into this too deep. Like, what constitutes an intake? Like, when someone comes in, like,
yeah,
not everybody that goes through the doors gets intaked, right?
Yeah, everyone that comes to
Every
the
single
door,
one? They end up meeting with you and then having a discussion with, or meeting somebody?
They can refuse, but they should have some sort of an intake physically, yes.
Mm-hmm.
Yeah,
Okay.
yeah.
Is that what an intake is, basically a physical?
Yeah,
A little more than that?
history too,
Okay.
you know,
Sure.
what have you been doing, you know, drugs, alcohol, withdrawal, you know, kind of medical problems, weight, blood pressure, stuff
So
like that.
intake, more than a physical.
And I would assume that with as bad as I and other people like me are about going to see the doctor on a regular basis, I assume these folks are a little bit probably worse about seeing the doctor.
Far worse.
So having somebody actually ask them questions about their medical situation probably.
Well, a lot of them are just self-medicating and not going to see the doctor,
Yeah.
you know, truthfully.
Yeah, they probably have some issue, they've had long-standing issues and then they come and see you.
Right, yeah, and that's why you see a pretty high incidence of serious medical problems with this population, so, yeah. Because and of course, they're on the street and they're doing things they shouldn't be doing and they're ignoring all the important stuff, but you get them in jail and all of a sudden they're sober and,
Yeah,
you know, then they realize they actually have issues, so. And that's, of course, generalization, not all of them, but many. I mean, we all know that's a high portion of the population there is drug and alcohol history, which puts them there. So, yeah. And then, if there's no more questions about that.
I got a few.
Go, of course.
All right.
No, you're good.
Yeah, some of the litigation trends that you see across the state have to do with sort of this interface between the non-medical staff having to sort of make calls about like medical conditions. Do you feel like the regular staff in the jail is adequately trained? Is there anything else we could do to increase?
What do you mean by medical calls? Like calling after hours, calling me, or calling for other?
Just for sort of being a good liaison, I think, you know, between, you know, what they see when they're dealing with the prisoners and, you know, then what they report back to you guys.
I mean, most of the calls I get are from my nurse, one of the nurses who call me. If they're there, that's who's calling me. Of course, they're only there so many hours a week, so that it's not full coverage. And of course, I mean, the more medical background somebody has, the more helpful it is to me. But I'm not sure how you change that, other than having more coverage with nursing, but you know, that's expensive. But again, probably 75 or 80% of the communication is coming from one of the two nurses, is what normally happens. And then as far as calling to get medical records from another facility or something, that's, I think, exclusively the nurse, I believe.
Absolutely. Other ones that would call in, like on a weekend or whatnot, would be a sergeant or OIC, and they have a protocol they have to follow. So if somebody comes in and they're,
Approvals.
or something, they'll call Lonnie to get approval for like detox kits or different things like that.
Yeah, and I get a fair amount of those weekend calls when someone comes in and, you know, John's on this list of medications and is it okay to refill those type of thing. But as far as, and of course, there's always the acute issue too, you know, someone's had a seizure, what do we do? So.
Okay.
All our staff is trained and certified first aid, CPR, AD, your basic medical needs, and they've been trained on medical pass, or medication pass, and dealing with that kind of stuff, so.
Great, great. If there's anything else you think that the jail can do to make your role more efficient, just let us know.
Okay.
One of the concerns that I've had has been the increased female population in the jail and the medical needs associated with that. And I guess that's a question that I always, it's in the back of my mind is do we have enough, is there anything that we might need or might consider as far as like a change to address those types of needs, because there are, a more sensitive nature, but also like can be more complex.
Right. So we used to have Adagio Health that would come in and help out with some of the female problems, but to be honest, I don't have all that many of those types of complaints, which is surprising to me. And usually if they have, say they have atypical bleeding or something, I do send them out because, they need to be addressed by, I wouldn't address that in my office, and, they need to be seeing OBGYN. And outside of getting someone like that in here, I don't know how much benefit it would be. But we don't have it a lot. Honestly, I'm surprised by that, but.
That's the correct approach. They have medical needs that we can't provide in the facility, they need sent out.
Right.
Well, and I think that's just my concern is that that's happening on a consistent basis and that no one's being turned away or put in,
Yeah.
'Cause it's not, I'm just saying, like, there have been a few times where I've run into people that were over there, this was a while ago, but, and that was one thing that was brought up, was this concern over, the attention being paid to the needs of the female inmates, and that's something that I, ethically I'm concerned about, but also from a liability standpoint, it's a concern.
We will treat everybody the same. If Lonnie or somebody medical says they get treated the same. Doesn't matter, and now where they gotta go, what's gotta be done. They need medically treated, they're getting medically treated. We're not gonna refuse anybody.
Yeah, and personally, I would be more sensitive, because that's not my comfort zone. I'm more sensitive to that, and honestly more likely probably to send that person to get the, additional care that they need versus something that I may be more comfortable with. And I think I speak for Dr. Horner on that as well. Because again, that's not stuff that we do much of, and even in our private practice. So. But fortunately, we have, 2 miles away, there's OB, and so people go if they need to. But as far as the routine screening stuff, usually they're not there long enough to need a pap smear, I need a mammogram, and those sorts of things. Not that I wouldn't do it if they asked me, but it's, if we were a federal prison and they were there for decades, that would change everything. And you have to have those services available right on in-house, I would say. But that's not the case. So.
Okay, any further questions? If not, I think it would probably be beneficial to approve the report officially. So I guess I would ask for a motion to approve the medical report for 2022.
I'll make that motion.
One second.
Motion made, second, discussion. Hearing none, all those in favor, please say aye.
Aye.
Opposed, nay. The ayes have it. Thank you very much, Lonnie.
Yep.
Appreciate it.
The only other thing I was going to do is, before everyone got here, we talked about the contract.
Oh, yeah, please, go ahead.
And the contract has been printed out by the county, and I didn't change a single word in it, except for compensation. So Dr. Horner and I haven't had a raise in 4 years. And so we were looking to get $150 each monthly additional. And I have a sheet here which isn't attached to the contract, which is just an explanation of rate increase. My malpractice insurance has went up 35% in the last 4 years, believe it or not. Nursing wages are up over 10% in the last year, which is going to make it hard for me to hire somebody at the current rate. And so again, what I was hoping for was Dr. Horner and I each to get 150 monthly, and then I was going to try to give my nurses $1 an hour raise, which would be basically take the old monthly rate to me, 10,238 to 10,688, and that's written here, so you can look that over. But that's what I was hoping for. Again, the nursing wages have just went through the roof, and in fact, we're losing our current nurse, our full-time nurse, because nursing is going to secondary outsourcing, where they're travel nurses, so they can go make double the money somewhere and do the same job, and that's exactly what's happening. So it's a tough road right now. And I hope I can replace somebody at that.
So we'll get that on the agenda, Jane, for the February meeting. Just give it to Pam.
Do you have a copy of that?
No,
Did that expire already?
Is it a calendar year?
It is not. My understanding was it was just an ongoing.
Yeah, I think that's correct.
I think
So
so.
we'll get it on the February.
Change.
We'll get it on the February agenda. Anything else? Any public comment? Hearing none, note that the agenda mentioned human services presenting on opioid issues, the opioid settlement. Commissioner Eggleston advised that they will present at the next meeting their recommendations, but they have made progress on recommendations. This time I will turn your attention to the minutes from October 25th. I had a few very minor.
Thanks, Lonnie.
Thank you.
Thank you.
Which are fairly worth mentioning or making any motions on.
You just.
So I would just ask if there are no comments or corrections on the substance of the minutes. I would ask for a motion to approve them.
I'll make that motion to approve them.
One second.
Motion made and seconded. Any discussion? None. All those in favor, please say aye.
Aye.
Opposed, nay. The ayes have it. Finance report.
We're a little under on the revenue side. We are definitely spending as much as we had anticipated on the expense side. We still have some journal entries to make for payroll for the last month or so, month and a half. And our biggest cost drivers are food. We're on budget with the December bill will be a little bit over, but the medical costs are way over budget. We budgeted 300 and we're at 350. So with these increases, we might want to add a little bit in our budget line item for 2022.
I think we had more
I just looked week.
hospital stays, long-term stays this year. We had like 1 month, it was just, there's 3, one got out, next day another one went.
This
One
is
got out,
the way
the
it
next one
is.
went to Warren, and it was just like, in the overtime, it was crazy.
That you don't have any for a while, and all of a sudden,
Yeah,
it's like,
I felt horrible for the staff because they were getting burned out quick.
Yeah,
you know?
I'm sure.
because it seems like a couple of years ago, we had one like that, we had a spreadsheet like that where we had people that were going up to St. Vincent's and something like that, and it's like, I remember looking at the bills and just like falling out of my chair.
Any questions for Lisa? Hearing none, I'd ask for a motion to approve the finance report.
I'll make a motion.
Second.
Motion made properly seconded. Any discussion? Hearing none, all those in favor, please say aye.
Aye.
Nay. Ayes have it. There's no old business. New business would only includes election of new officers. So there's 2 positions that we elect here, correct? The chair and the vice chair. It's been joked about in other meetings that Sheriff Seibel wants to be and was going to be nominated.
I nominate Sheriff Seibel as chairman.
I second.
So there's no seconds needed in nominations. I'll ask for a motion to close nominations for chair.
Second. First. Whatever.
Motion made. Is there a second to close nominations?
I'll make that.
Okay. All those in favor of closing nominations, please say aye.
Aye.
Since there was only one nomination, the sheriff is the 2023 chairman. I'll now open nominations for vice chair. Commissioner Durbin is currently the vice chair.
I nominate
Come on,
Commissioner
come on.
Durbin for the vice chair.
Attorney Green, do you not want to be vice chair?
No. No
Or
chance.
Ferguson, would you like to be vice chair?
Very good, and I ask for a motion to close nominations.
So
Give me a
moved.
second.
Second. Yeah,
Motion made and properly seconded. All those in favor, please state aye.
I,
Okay, nominations are closed, and as there is only one nominee for vice chair, congratulations, Commissioner Durbin.
I didn't vote. Nay.
Yeah, I still have it.
Is that under the different rules of order? Like, if there's only one nomination, then you don't take the vote? Is that?
It's just
I don't know the
I mean,
rules.
there's no one else nominated, so.
You know, what's
What else did you do?
I think very technically, according to Roberts, you still do need to take them, yes, to actually follow through. You're supposed to take a vote on
you
nominees.
can do it by nomination.
Sometimes you don't use Roberts, you have that
I
other.
usually use Rosenberg, but Rosenberg doesn't
Right.
have this level of specificity when it comes to nominations. So everyone's understanding is that, I think everyone's understanding is clear.
Okay.
Okay. Warden's report.
Everybody received a copy of it?
Mhm.
Don't really have much additional to that. Just doing all our end of the year reports with the state, everywhere else. Working on their next year training. We've got a large agenda of training next year. We're kind of excited about mostly in-house stuff, so some of the costs in the actual the county, but we're definitely ramping that up quite a bit, I think.
Okay.
Any questions for the warden? Hearing none, I ask a motion to approve the warden's report.
Make that motion to approve the warden's report.
A second.
Motion made, seconded. Any discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, nay. Ayes have it. Under announcements, we have already advertised next year's meetings, correct? Okay. Are there any objections? Did we officially vote on that in this meeting, or did we just publish it?
And then we talked about it at, I sent out an email to get the board's approval to do them on the Tuesdays of the same week as the last commissioners meeting.
Right. And no one objected to that, nevertheless, the email, it was just an email, so I would suppose I would ask for motion to approve the meeting times listed in the agenda. It would be February 21st, April 25th, June 27th, August 22nd, October 24th, and December 12th.
I'll make a motion to approve those meeting dates for 2023.
A second.
Motion made and seconded. Any discussion?
I will probably not be here for the February one at court.
Okay. And again, that would be at 14:30 in this room. Unless otherwise noted. Motion is made and seconded to approve that slate. All those in favor, please state aye.
Aye.
Opposed, nay. Ayes have it. So the next meeting will be February 21st at 14:30 here. Is there anything else that needs to be said for the good of the order? Hearing none, I would ask for a motion to adjourn.
So moved.
Second.
All those in favor?
Aye.
We're adjourned, 14:56.
Thanks, everyone.
Thank you.
I'll see you. Have a Merry Christmas.
You also.